I love it because it's like two worlds at some point are starting to mix, right? And it's very funny because healthcare has data, but not engagement. And wearables have engagement, but not clinical depth. So it's like the chicken and the egg problem. So it's like if you start to mix both, you start to see better things. And people don't want to be managed. They want to be motivated.
Right.
Maybe through gamification, maybe through feedback loops, maybe through personal goals. They can be more aware of everything and start to doing something with the data and start to doing something for their own health. So we are moving from reactive care to preventive health.
Welcome to the Digital Healthcare Experience, brought to you by Taylor Healthcare. Subscribe now and stay on the forefront of the digital healthcare revolution.
Hello and welcome to the Digital Healthcare Experience podcast presented by Taylor Healthcare. I'm your host, Chris Civitarice, and today I'm thrilled to be joined by Marco Benitez, co-founder and CEO of ROOK. He's built his career at the intersection of health, technology, and sports science. Starting as a Taekwondo champion, Marco's discipline guided him into biomedical engineering, then into high-stakes roles in pharmaceutical giants like Roche and Novartis. Here, he witnessed the transformative power of data in healthcare and saw a profound opportunity to make health metrics more accessible and actionable. Drawing on his years in pharmaceuticals and clinical research, he created ROOK to bridge the gap between raw health data and actionable insights. Initially focused on wearable tech for fitness, ROOK evolved, expanding into healthcare and insurance as Marco envisioned a platform that could make data universally beneficial. Welcome, Marco. It is great to have you on the show.
Chris, thank you so much. Very, very excited to be here. And thank you for this space.
Absolutely. So to start, give us a little bit of history about your background, which is obviously quite interesting. And talk to us about what led you to start ROOK and the work that you're currently doing with the company.
I am Marco Benitez. I am from Mexico, now living here in the US the last almost 3 years. In Mexico, I studied biomedical engineer. That's my background. We created our first company like in 2003. So we were very young. We were in the college with my best friend in the same, apartment. And then we started to build something from the scratch. That's where we saw the huge thing of building something from nothing until we sold that company. So it was amazing, the experience of, having these conversations with the hospitals, with all these people trying to use our platform. So it was a really, really great experience. But if I do one step also back, I love sports. So that's my real passion. It's like I came from the Taekwondo space, which is a big thing down in Mexico. Taekwondo is something really big in the Olympics for Mexico. We are always between the first and the second place. So Taekwondo is something really important for me. It's like that activity gave me, all the discipline, perseverance, be consistent, all the things that you want to achieve. It's amazing. Any martial art, I think it's the best thing you can do for yourself. And Taekwondo for me made so many things, so many. It's like you are tired, but you still have to be fighting, having someone in front of you and try to kick, the head or do something with that person that you have in front of you that give you so many things at the same time. So it's amazing. It's an amazing sport. I think that allows me to do what we are building today and all my path in different industries and all of that. So yeah, that's a quick summary of my background.
Yeah, it's fantastic. And if you can, give us a little context about ROOK and what the company does.
As I said before, we love to build things from the scratch. So ROOK, it's two passions that I have in my life. One is sports. And the second one, it's devices, wearable devices. So early 2000s, I remember myself using different wearables from Polar, for example, Polar and Garmin. They were so huge, and I used to use these heart rate monitors to track my heart rate beat, my effort zone. That helped me also to improve myself for these fightings in the taekwondo space. So for me, really have a meaning. Track something and try to make correlations. For me, it's everything.
Yeah.
So it's like any company. You have to track things so now you can improve them. So it's data, 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 and then improve things. So basically, we are doing the same thing. We identify a huge potential of what's a very good opportunity. Let's say before pandemics, the FDA started to approve some wearables as medical devices.
Right.
And we saw that that was huge. And a lot of industries now were trying to pull this data for their own convenience to use it for, I don't know, tracking patients, maybe, or tracking habits, tracking something from the end user so they can improve that part. The main problem over there, it's like, first of all, these companies, let's say a hospital, they need to integrate all the devices first before they extract the data.
Right.
So there are too many wearables right now. Early 2000s probably was like 3, maybe 4, companies that were doing this type of things. Garmin, Polar, of course, Apple Watch. There were not too many. And today it's a completely different thing. So you find the Whoop, Aura, Polar, Garmin, Sunto, Huawei, Withings, 8 Sleep, Xiaomi. I can continue. Right. It's like it's crazy, but every single month you find a new wearable in the market. An earring, CGM, a patch from Sweat, I don't know, in your shoes, soles. It's crazy. And I think each device is trying to solve one specific problem. And the hardware, it's more accurate, which is great. So we saw that problem. So we were like, okay, what if we started to integrate these APIs on one API? So now these companies, they only have to integrate our API, and then they can use all this information without having, they need developers and different type of things, data scientists, right, just to integrate all these APIs. So that's how everything started. And then we saw the mess of the data. So basically, when every single device speaks a different language. So if you are trying to use all these data without cleaning it, you don't have data. You have noise. So that's the other problem that we solve. So we have on our cloud different algorithms that help to clean all this data. So now hospitals and insurance or fitness apps or longevity apps can use that data to analyze, to make correlations, to do graphics, to compare, people. So that's how normally it works. So we are an API.
Yeah, that's great. And I know I've heard you talk before, and I've seen just a few weeks ago, even on LinkedIn, I think you referred to, there's a difference, right, between tracking your sleep or tracking your steps and actually generating data that's FDA approved for clinical use. And you touched on that there on the intro. And I want to dig a little bit deeper into that. Specifically, when I think about wearables, one of the things that comes to mind is credibility. So I'm curious about your perspective on some of the hurdles that you're facing or have faced in making wearables clinically credible beyond just some of those basic things in terms of, you can track your sleep or track your steps. How do you get there?
Yeah, that's really a big problem. It's like track is easy, right? But trusting the data is really hard. It's not the same thing. I will say that most wearables are designed for finding trends and not diagnostics. And then if they want to cross that line to the clinical territory, they need to validate algorithms, standardize metrics. They need to create traceability, and they really need to show to the FDA and EMA how each data point was processed. So they need to show so many studies. They need to make correlations between a medical device and their own wearable. So it's too many things that these companies, they need to do in order to receive an FDA clearance.
Right.
So Apple Watch was the first one who received this FDA clearance, and I think they were the ones who paved the road. Now, all the wearables want to have an FDA clearance, which is very difficult because they need to do a lot of filing and submissions to the FDA, then receive a rejection, then they go and answer all these questions. And it's a lot of back and forth.
Right.
And money, of course.
Sure.
And it's really complicated. So it's not that easy for them. I think it's a really complicated job for them.
Yeah, absolutely. And I mean, it sounds like, things like obviously accuracy is important, reliability, compliance. It just opens up a whole bunch of different kind of avenues and cans of worms that you have to kind of navigate through in order to reach that point. The other thing that comes to mind when it comes to wearables and being able to use data more effectively is interoperability. And I know you touched on that from an API perspective and the things that you're doing. Can you give us a little bit more on that and specifically talk to us about how the healthcare industry can actually use and access the data?
Yeah, that's a very good question. First of all, hospitals, they have different languages in their own systems.
Yeah.
That's why was created the FHIR and HL7.
Mm-hmm.
So it's like a common language that you can start navigate and show. You can send all this information and they have a specific data points. So now they can pull all this data. So it's like that's a real big problem over there if you want to start just tracking new data from other places like wearables.
Right.
On our side, that's one of the problems that we are solving. We already have those languages. So we are FHIR compliant, HL7 compliant. So once we extract the data from those wearables, we can send that information to the hospitals. But interoperability is a big problem. It's a real big problem because, again, talking about in the US, I think the US system is much better than other countries, but much better. I'm from Mexico. I know the problems over there in Latin America, not all Latin America, but because also each country has their own problems. Not everything is in a digital way. So we still have the hard copy. We have paper, and that's a big problem. And only in Mexico, you have like 7 type of systems in the health industry. You have public, government, you have private, you have different privates, then you have military, you have, it's so complicated and it's so fragmented that you can have one system. Here in the US, it's a little bit completely different. You at least have a one system or two that can give you all this information, like Epic, for example, who can, consolidate some information, but not all the hospitals has this situation. So interoperability is a big problem. And that's one of the things that we want to solve with only the data that we are capturing from wearables, but also lab testing and also other type of medical devices that our clients need to analyze better the patient.
It's interesting because if I think about, just me as a patient, I think about, I use the hospital or the health system and I may be interacting or the clinicians may be interacting with Epic. If I go to, my primary care physician, he may not be interacting with Epic. He may have a totally different system. If I go to my orthopedic, specialist, she may have a completely different system as well. Is that part of the problem in terms of, I have this data, that's my data, it's my, derived from my wearables or wherever it comes from. And now it needs to get to maybe not one place, but probably multiple places. Is that a fair assessment of part of the problem there?
Yes, it's part of the problem. And we know some companies that are trying, they are the connectors. They are like a octopus. They are trying to, have the data and translate all this data. I mean, we are setting the ground with HL7 and FHIR, at least. So that's the good news, right? Yep. But still, to your point, it's a big issue still.
Yeah. The other thing that comes to mind, we've certainly the provider side offers its own complexities and nuances, and then we have this whole other side of the equation in terms of the insurers and the payers. So I'm curious, talk to us a little bit about that dynamic and what you're seeing in terms of insurers and certainly health systems as well. But what are you seeing in terms of that integration of this kind of, it's almost continuous lifestyle kind of data that goes into patient care or into coverage models? Talk to us a little bit more about, especially that insurer side of the fence.
I think insurance it's a really interesting industry. It's really interesting because they are the ones who are moving the needle a lot.
Right.
They have their own CPT codes, and depending on your CPT codes, that's the things that make you reimbursable. Now, I hear more and more and more that they are moving towards the prevention. So we are moving from reactive care to preventive health, which is great.
Right.
And now they are moving the CPT codes to the prevention side. There is a lot of organizations that are trying to push more and more and more to change a little bit these CPT codes. And I think the whole industry also is starting to use this continuous information from patients so they can do better analytics.
Right.
And they are doing like incentives, they are doing discounts in your policy if you have healthy habits, depending on your stress levels, depending on your sleep data, depending on your nutrition, depending on if you are very active, if you are doing 7,000 of steps or 10,000 of steps. I think that's one way to prove if someone is, active. And I think everyone should be. At the end of the day, it's very important. It's for your health. At the end of the day, it's like you have to be ownership of your own health. That's the important thing. Absolutely. Right? So insurance is one. It's another actor in the whole ecosystem. It's a very important actor.
Yeah.
So they are trying also to change the rules, but it's difficult. At the end of the day, they are really old industry, but they are moving, and we can see a lot of insurtech companies coming. Not sure if you, like a couple of weeks ago was the ITC.
Right.
The ITC in Las Vegas. So it was amazing. All these new platforms and, technology trying to improve and, to move a lot the industry. I think that's very promising. It's really great.
Yeah, absolutely. I mean, and to your point, I mean, I think the ecosystem is entirely the right word. And every time that we talk about new technologies and where the ball is kind of going as an industry, it's fascinating to think about those different stakeholders and kind of think about the implications for each of those, kind of legs on the stool, if you will. So it's really fascinating to think about insurers that have finally kind of taking the perspective of, hey, if people can live more healthy lifestyles, then that's going to be good for all of us. It's good for the insurer, it's good for the patient, it's good for everybody. So that's it's good to hear that they're starting to see that come to fruition a bit. This next one is I think going back to kind of around a little bit on the behavior side, a little bit on the trends, a little bit on the AI side as well. But we have now 24/7 data streams that are coming in from wearables. It's not I'll take my heart rate every hour when I'm in the hospital or when I'm at home or what have you. It's 24/7, and we can see behaviors and trends across this huge time frame that may correlate with disease risk or what have you. So I'm curious about what kind of, when you think about those preventative insights that you mentioned earlier, what kind of preventative insights are we starting to unlock? And then the second part of that question is, how is that being impacted by AI?
Yeah, that's a very good question. Two things. One, again, you have continuous information from your wearable, right? So, for example, myself, I do a lot of tracking. I have an Oura Ring, I have a Whoop, I have an Apple Watch, and I have the 8 Sleep, I have a CGM, and that's mainly because of my company, right? Because I am the worst end user ever because I have so many data points that my developers and my data scientists are really crazy working and trying to normalize everything. They hate me, but that's the best way to start using our API. But it's, for me, was a very interesting to see my trends when I'm, for example, drinking. When I do. When I take a beer or tequila in the night, what happened with my HRV? What happened with my stress levels? That give you awareness. So just with that, that's amazing. That's super important. Just receive awareness about what happened what happened if I do workouts in the night? What happened if, and you start to reaccommodate different type of things on your behaviors every single day. That for me alone works a lot.
Right.
But I know that not everyone is very like, for example, my wife, it's a very good example. We are on the opposite. She's like, oh, she has the Apple Watch and that's okay. But she doesn't care because she is not very like, she doesn't look the data and she doesn't make correlations. She wants everything very easy for her. It's like, please tell me, what can I do? Period. So that's when AI coming to the table. It's like, okay, maybe we can add a layer of AI and all the things that I already know, maybe she needed more digestible. So it's like a very simple. So now we put an AI and this AI can do some trends and can give you the same insights or better insights. Because that's all about AI. AI, it's maybe you know what to do with with different type of information, but it's simplified. At the end of the day, I can do a very good summary about a book. I can do it by myself, or I can put the book in AI and the AI do the summary for me.
Right.
It's like how can we improve the tools that we have? And of course, I prefer to read a book, obviously, but it's like to my point, it's like we can do the same thing with all these trends, things that I'm discovering. It's all, if I put all the data points in this AI, probably will show me the same thing or even more things that I'm not aware of.
Sure.
So I think it's becoming more and more interesting, this AI thing.
Yeah, that's fascinating because if I think about, like, everybody knows that if, you eat poorly or you drink too much, then there's going to be adverse health, events and so on and so forth. But that notion of being able to correlate almost on like a real-time basis, you had, this to eat or to drink last night, and here was your sleep pattern, afterwards. You exercised for 4 days in a row, and look what it did. Look at your blood pressure, look at, your heart rate, whatever it might be. It's really fascinating to be able to take those data points and provide that real-time feedback to influence behavior. I mean, certainly the data is wonderful for insurance companies, wonderful for, health systems, but that's really powerful, it sounds like, from a healthcare consumer perspective.
Oh, yeah. It's again, data is power.
Right.
And
let's stick with that consumer notion. So the wearable industry, kind of as a whole, they've really mastered consumer engagement, right? They're motivating people with goals and feedbacks. My Apple Watch tells me you haven't stood up in a while. Get up, get out, get walking around. So you've got goals, you've got feedback, you've got gamification. What can healthcare learn from that the wearable industry has done a really good job of?
I love it because it's like two worlds at some point are starting to mix, right? And it's very funny because healthcare has data, but not engagement. And wearables have engagement, but not clinical depth. So it's like the chicken and the egg problem. So it's like if you start to mix both, you start to see better things. And people don't want to be managed. They want to be motivated.
Right.
So now, if we go to the hospitals and show that information in a very easy way to the patients, maybe through gamification, maybe through feedback loops, maybe through personal goals, they can be more aware of everything and start to doing something with the data and start to doing something for their own health because they are the ownerships over their own health. It's like maybe the healthcare can start doing more games, but the industry of healthcare, it's very difficult. It's very like, it's difficult at the end of the day, but they have to start moving towards that part. That's why people create wellness and longevity.
Right.
It's the same people. But maybe if you put the label of wellness and longevity, is like it's more fun.
It's a great point. I mean, it's just it's not really changing anything other than the way that it's framed and the sort of state of mind that you're putting people in to be receptive to the message. It sounds like then.
Yeah, like that.
Fascinating.
Again, because healthcare is more reactive. Period.
Right. Exactly. Mm-hmm. So let's talk about that concept a little bit further. The patient as a consumer. Because all of what you're describing, that I feels like that's kind of at the heart of it. So how do you see that concept, the patient as a consumer, evolving as healthcare technology becomes personalized, proactive, continuous? How do you see that evolving, that patient as a consumer mentality, philosophy, or concept?
I think it's a very good and interesting philosophy because it's like a philosophy word, because at the end of the day, we are moving from reactive. I already said that. It's like we are moving from reactive care to preventive health. So people is expecting to use the healthcare experience to be as a personalized, like their Spotify playlist.
Right.
They want to have everything very, personalized and customized. So the new generations, I think, they don't want to be just patients. They want to be participants. And they want to give them, I think the healthcare need to give them all this data and the power to use it very responsible. So again, as I said before, they have to take awareness and ownership of their own health. And everyone, it's like, I go to the hospital and the doctor is the responsible. I think that's how it was before. Now everything is changing because all the ecosystem is changing. You are responsible of your own playlist in the Spotify. You are responsible of your own, also like ChatGPT. All the things that you find in ChatGPT is very personalized. So it's very customized. It's crazy. Talking about Spotify, I really hate when my kids, to my Spotify, because it's like when I do the mix, it's crazy because you start to see, AC/DC, which I really like, or Ozzy Osbourne. From some reason, something happened, and now we have, I don't know, what's the name of this shark? Baby Shark and all this stuff.
Yeah.
Baby Shark.
Yeah, I feel you.
I don't know,
6-year-old, they really screw with the algorithms.
They screw the algorithms, right? So it's crazy. I hate that part. But yeah, it's really funny. But and then Pokemon and the new trends in Netflix and all this stuff. So I know, you know the drill.
K-pop
You know the
Hunters
drill.
is going to be on everybody. If you
Yeah.
got a kid, it's going to be in your top 3, played Spotify list at the end of the year.
I was doing workout this morning and I was very high with the Ozzy Osbourne, and then happened that thing from Netflix. What's the name? Is
the K-pop Demon Hunter?
Yeah, my goodness. And it's really sticky, by the way.
Oh gosh, it sure is. Absolutely. I'm sure that's going to be a franchise at some point. I don't think we're done with K-pop Demon Hunters, as much to my chagrin, but we'll see.
Yeah.
Well, Marco, is there anything else that you're working on, excited about? Anything at all as we come to the end of our conversation here? Anything at all that you're working on or excited about that you want to share with the community?
Yeah, I mean, I'm very excited with all the things that we are building. It's like we are solving a very big problem just with the interoperability between all these wearables and lab testing and medical devices, and giving one format so now our clients can use it. But also we are becoming more a data science company.
Right.
So it's like the API is just one way to extract the data, but it's now we are doing a lot of correlations. That's what we really love. That's why we invest everything on data. In data science, we have data scientists. So now we can do something with that and we can do correlations. We can help those companies to unlock people's health. That's for me the big vision. It's now we have a lot of data. Now we can build more things with that information for the end users and patients and everyone.
It's so exciting. I hope that you'll come back and join us as you continue through the journey at ROOK. And last thing, just quickly, if you could, let people know where they can go to find more information about ROOK.
Of course. Always in the web, we have tryrook.io. And then in LinkedIn, that's where we are very responsive in ROOK, or you can find me as Marco Benitez, or any of my partners, my friend, the people that work here in ROOK. Super happy to have very good conversations.
Fantastic. Thank you so much for joining us today, Marco. It was such a pleasure having you on.
Thank you so much, Chris. It was a pleasure.
And thank you also to our listeners. If you enjoyed the conversation, please like, share, and subscribe to help us keep growing the show. And if you'd like to learn a little bit more about Taylor Healthcare and the digital healthcare experience, you can go to taylor.com/digital-healthcare. That's our show for today. And until next time, this is Chris Civitaris wishing you health and good cheer. Take care.
To learn more about Taylor Healthcare, please visit taylor.com/digital-healthcare. This podcast is for educational purposes only and is provided with the understanding that it does not constitute medical, legal, or financial advice or services. The Digital Healthcare Experience is produced by Naomi Schwimmer. Podcast music by Nicholas Bach.
Health literacy benefits patient and provider alike, but how can patients take control of their own care? Introducing iMed Health from Taylor Healthcare, digital tools that support patient education and health literacy. Go to imedhealth.com to learn more. Find the link in the show notes.